Good day! I am Dr. Wilfredo S. Tagle, urologist, and welcome to Medical PracTIPS, a series of tips and tricks to help you jumpstart your medical practice. Today, we will be talking about how to get referrals from your co-doctors. Okay. Number one, umpisa natin kaagad. First is developing awareness. Okay. So, you have to let everybody knows that you are practicing in this field, in this hospital, in this clinic. So, if somebody thinks about your specialty, about your disease problem specialty, they will know or they will think about you and where to refer patients to you. Remember, it's not only doctors that could refer to you, they could be referred by your co-employees, your relatives, your friends, and other friends or relatives of your former patients. Okay? So, we should be aware that there's such thing as Dr. Juan de la Cruz, a specialist or good in this field and practicing in this area. Okay? So, that's number one, develop awareness. Number two, be trustworthy. Pag sinabi mong doktor ka, dapat doktor ka. Lisensyado kang doktor. Hindi ka fake. Okay. Number two, if you said that you are a specialist in this field, be sure that you are really a specialist in this field. Kung ano ang sabihin mo, whatever you say to the public, whatever you introduce yourself to the public, it should be true. So you have to be a trustworthy person. Okay? Number three, you have to add value to your service. If you are a doctor, you are treating your patient, you have to add value. For example, you have to be friendly, you have to be caring, you have to be associated with other persons that he or she knows. You have to, it's not only treating patients, it's not only diagnosing patients, but you treat your patient as a person, as a whole person. Okay? So you have to add value to your services. Next is you must give timely response. If somebody says that, Doc, I have a referral to you in this hospital, in this field, in this area, you have to respond properly. Okay, as much as possible within 24 hours. When a patient is referred to you, that means they need immediate response or your care. So, don't be there after 3 days, after 1 week. As much as possible, be there right away. As I said, the considerable length of response time for non-emergency patient is at least within the day. Next, you have to have a proven track record. Okay? So when patients or doctors or colleagues ask about their friends, about their patients, you have to have a proven track record. Dapat pag sinabi, si Dr. Juan de la Cruz, magaling yan. Malambing yan. Madaling kausap yan. Okay? Have a positive, proven track record. Okay? Next is that you must also be consistent. Consistency. Pag sinabing ang schedule mo ay every Monday, Tuesdays, and Wednesdays in that hospital, you have to be there consistently. Hindi yung minsan naandun ka, minsan nasa kabilang ospital ka, minsan nasa ibang araw ka, hindi malilito yung buong community. Not only the patient, but also your colleagues. So you have to be consistent. Okay? Next, you have to practice reciprocity. Okay. For example, in your colleagues, if a cardiologist gives you a referral to a urologist, then someday you will have a patient who needs a cardiologist or have a cardiac problem. You also have to refer that patient to your friend or your colleague who is a cardiologist. So you have to have a reciprocity. If your patients have referred to you, for example, an engineer who have referred to you a patient, and some of your patients, your next patients, needs also the professional help of an engineer, you can also refer to your former patient who is an engineer. So you have to practice reciprocity because there's no man in an island. You have to help each other. Next, you have to consider the timing on peak satisfaction state. Timing is everything, okay? If you're going to tell or broadcast something to your patient, for example, the patient needs operation. Then, when you reach the patient was very angry and telling him that you are not giving him the proper care. Please calm down first your patient. Just don't barge into his room that say, you need an operation. Always give or respect the patient and do the proper timing. Timing is everything. Okay? So that's it for today's episode. Please like, follow, and subscribe to our Facebook and YouTube page. And catch the latest episodes of Medical PracTIPS every Wednesday at 7 p.m. And please share this episode of Medical PracTIPS to your colleagues so we can help more young doctors build their practice and serve their patients well. See you. Bye-bye.